Some health experts are doubting claims by President Akufo-Addo that his government's COVID-19 policies have resulted in a significant drop in active cases. In his 15th address to the nation, the president mentioned 4 out of the 16 regions, Savannah, Upper East, Upper West and Northeast, are without any active case of COVID-19. But an epidemiologist and senior lecturer at the University of Ghana Medical School, Dr. Benedict Calistego, doubts this claim. We hear from him shortly, but before that, let's hear from the president.
I indicated that a closer look at the data points to the fact that we are steadily on the path towards limiting and containing the virus and ultimately defeating it. And I requested all of us to pay particular attention to the number of active cases. As of 24th July, the number of active cases, i.e. persons with the virus, stood at 3,307. As of Saturday, 15th August, 3 weeks later, the number of active cases stands at 1,847. This is a clear indication that government policies are working. Currently, there are no recorded COVID-19 cases in the Northeast, Savannah, Upper East, and Upper West regions. And I charge their residents to do everything possible to maintain that situation. Greater Accra, Ashanti, Central, Eastern, and Western continue to be the regions with the highest number of active cases. Thus far, a total of 40,567 persons have recovered from the virus. This means our recovery rate has improved from 89.5% to 95.1% in 3 weeks. Our death rate continues mercifully to be low at 0.5%. Happily, there are no backlogs of tests at any of our testing centers.
Now, Dr. Benedict Calistego doubts this claim. He says the figures being churned out are not a true reflection of what's on the ground.
We need to look at these pieces of information and the data carefully. It is one thing having data and another thing interpreting or misinterpreting the data. We have been testing for cases and picking up cases. Over the time, from the time we started this management, the number of testing is gradually declining. We are no longer doing aggressive testing as we used to do. Now, the number of active cases we have at any point in time is a direct product of our testing rates. If we are testing more and the disease is in the community, we will be picking up more. If we are testing more and the disease is not there, we would be picking up less. However, if we are testing less, it stands to reason that we would pick up less. So the number of active cases is just one side of the story. For any communicable disease, there are 2 groups of people you worry about as far as transmission is concerned. The active cases, those who have been diagnosed as having the diseases, that's one group. The second group are those who are asymptomatic but still have the capacity to transmit this infection. We refer to them as carriers. For the active cases, we have identified them and we are in the position to implement our isolation measures and treat them. How about those we haven't identified? These are the ones we should be worried about, bearing in mind that over 50% of even the diagnosed cases did not show any signs or symptoms. Okay. So the possibility that there are cases in the community which we are not picking up cannot be ruled out.
Okay, so what it is that we should be treading cautiously or rejoicing cautiously when we say that our active cases have gone down.
Cautiously. And it will be erroneous for anybody to say 4 regions have no cases, because we haven't tested everybody in those 4 regions. Okay. At best, what we can say is that For those who have been tested, no cases have been recorded.
General Secretary of the Ghana Medical Association, Dr. Justice Yankson, wants the government to focus on the rigorous testing as the president initiates plans to open up the economy.
It is the restriction. It should be in a position to test as many people as possible as and when the need arises. For example, we are going to get the continuing students to go back to school, those in a tertiary institution. These are huge numbers. Nobody is praying that they get infections in there. But in case there are any fallout, we should be in a position to do same. As we ease other restrictions, conferences, what have you, what it means is that anytime there is a need for us to test, we need to be able to test. Mind you, within the clinical setting, as we speak, we are still getting cases from the general community as well. And like we had discussed earlier, there's a need for some enhanced contact tracing and what have you for such people.
Okay.
So what
It's still live on the Pulse with me, Daniel Dazi. Let's take the latest figures as available on the Ghana Health Service website. 121 new cases, 1,847 active cases, down from 1,906. You want to look at the number of recoveries and discharges, 40,567. Confirmed cases. Now, this represents everyone who has tested positive in Ghana since the 2nd of March, 42,653. However, 8 more people have died. 8 more people have died, bringing the death toll to 239. May their souls rest in peace.